name's Nurse Sarah, and I've just taken over this shift, and I'll just be doing some checks on you, okay? And hopefully we can send you home. Alright? Okay, how are you feeling? Good, good. Okay. Are you in any pain at all? Little bit around the ears, okay. That's where you've had your surgery, so we'd expect that. But we've given you some pain medication, and we'll also give you some to take home with you if the doctor's happy to discharge you. Alright, that's fabulous. Do you have any dizziness at all? No, just feel a little bit fuzzy-headed, okay? That's normal after general anaesthetic, but we'll keep a little eye on that. And you had a little bit of nausea earlier, but we gave you some anti-sickness medication for that. Do you feel better now? Good, that's fine. Again, that's very normal after general anaesthesia, and especially with operations on the ears as well. Okay, that can cause a little bit of dizziness. Alright, okay. Now, if we are going to discharge you today, just want to double check the name of the person that's going to be picking you up and taking you home today. Okay, let me just check. Yep, that's fine, okay. And do you have someone at home to look after you for a few days, or you can go and stay with? Okay, so this person is going to stay with you, that's perfect. And they'll be getting you your food and drink and anything that you need. That's wonderful. Okay, now we will give you the number of the ward, so once you get home, if you don't feel well at any point, you can call us directly. Yeah? That's perfect. Okay. And if there is any changes to the person that's looking after you, okay, could you just please let us know? Give them their details. Okay, because we'd just like to know who it is that is going to be taking care of you for the next few days. So just pass their details to us if it has changed from the person that we've got on record. All right, okay, that's wonderful. Okay, right. So let's just have a little feel around your face. How does that feel at the moment? Okay, is that okay? Very good. Okay, if I just put my fingers there, could you just open and close your mouth for me? That's wonderful, thank you. And again. That's great, okay. Alright, I'm just going to have a little feel down your neck. Is that sore? That's good, okay. I will be checking out those ears shortly, but at first I just want to do some other little checks, okay. I'm just going to take your temperature. So I'm just going to point this at your head. You won't feel a thing, okay? You'll just hear a couple of beeps. Okay, nice and still for me. That's perfect. Your temperature is absolutely normal. That's wonderful. Okay. So I'm just going to have a little listen to your breathing, if that's okay. Alrighty. So make sure the stethoscope's nice and warm. Don't want to shock you. Okay. Are you feeling warm enough at the moment? That's good. Okay. Because you can feel a little bit cold after surgery, but I think you're through that phase now. Alright. Okay. I'm just going to place the stethoscope onto your chest. Alright. And I'll ask you to take some nice breaths in and out for me. Okay. So there we go. And in and out. That's perfect. And again, in and out. One more time for me. In and out. That's perfect. Okay. Now I'd like to just take your blood pressure. Okay. So could you just outstretch your left arm for me? I'll just put the cuff on. And I'll inflate the cuff. It will feel a little bit tight as I do so, but it won't last for long. Okay. There we go. There. Okay. I'll just pop the stethoscope into the crease of your arm. Keep nice and still and breathe normally for me, okay? Thank you. Just going to inflate that now. Is that okay? Good. That's fine. Let's take that cuff off. Okay. That's all good. I'll just make a few little notes there, alright. Just going to pop this onto your finger just to take your oxygen saturation. Okay, I'm sure they're fine. You seem to be fine. You look a really healthy colour and you're breathing normally. And you were fine when you came from recovery, so I'm just going to pop this onto your finger. Let's just have that finger there, lovely. Thank you. There we go. Only takes a second. Wonderful. You're checking out perfectly well so far. Alrighty. Okay. So I'd just like to take a little look inside your mouth and your throat. Alright. Okay. So I'm just going to get a tongue depressor. There we go. If I can ever get them out of the packet, sometimes they just don't like to come out. There we go. Okay. I'm just going to shine a light into your mouth. Alright. I just want you to open wide for me. I'm just going to pop this in and have a little look around. Yeah. Okay. There we go. Perfect. Thank you. Can you say "oh" for me? Alright, okay. Could you just pop your tongue out a bit further? Perfect. Could you put your tongue to the roof of your mouth for me? Okay. And pop your tongue down. That's perfect. Thank you. That all looks wonderful. Okay. Okay. Full marks so far. You'd like a drink? Yes, I can give you a drink now. I've got you some water here. Now don't go crazy with it, okay? Just little sips for now. Alright. There we go. Little sips. But that feels better, doesn't it? You get such a dry mouth after surgery. Oh, and it's a combination of the medications and also the breathing tube. It can make your throat feel a little bit sore and scratchy for a while. And we use gases as well, which can make everything feel a bit dry. Is that okay? the zip for now. There we go. Great. In a little while, when the doctor's been to see you, we can give you a nice drink of tea and some sandwiches. Yeah, and then you can go home. Okay, we'll get that arranged for you soon. Yeah. Okay, so I'm just going to mark down that you've had a little drink. And you feel okay? Yeah, that's good. We want that water to stay down, don't we? That's good. Right. So, I'm going to check your ears, okay, next. Now this is obviously where you've had your surgery, but I just need to have a look down your ear, around the ear, and make sure that everything's looking good. Okay, I'll be as gentle as possible, because I know they're feeling a little bit sore. Alright, I'll just get my things ready for that. Okay. Okay there. Good. You like another drink? Okay. Before I check your ears, have another little drink. It's nice and refreshing, isn't it? Cold water. There we go. Okay. Right. The first thing I'm going to do is I'm just going to use this mirror. I'm just going to pop it behind your ear, and it'll show me what's going on behind there without having to get right round you. Okay, and have a poke around too much. So just bear with me. I'm just going to have a look around. Okay. Okay. Just pop my light on there. Just to have a look. That's looking great. That's looking really good. Okay. Okay. Just have a look around this side. Just round the back here. Okay. That's looking good. Okay. Right. I'm now just going to have a little feel behind your ears. Okay. Okay. Is that okay? Good. Right. Now I'm going to get very close to your ears and have a close inspection. Okay, just round the front. Just keep very still. Alright. I'll be very, very gentle. Okay. I'm just lightly pressing on the ear. Okay. Very lightly pressing there. Does that feel okay? Right, okay. Just gently touching that. Okay, is that okay? Good. Good. Everything seems to be fine. I think you're going to heal really well from this surgery. Okay. I'll just do the same on this side now. Okay. Just having a little press around. Does that feel okay for you? Okay. Okay. Just gently stroking there. Okay, perfect. That's all looking really, really good. I'm so happy. Wonderful. Okay. Now for the next part, I'm just going to have a little look inside your ear. Okay. I'm going to use the otoscope here. Now, normally I would pull up and back on the ear to have a look down, but I'm not going to do that today because of the surgery, okay, because you've got a couple of little sutures in there. Alright, so I'm just going to see what I can see without causing you any discomfort. So just please keep really still for me as you've been doing, and let me have a good look around. Okay, I'll be really gentle, I promise. Okay, so I'm just going to insert the otoscope. There we go. Just looking around. Okay. From what I can see, everything looks clear. Just moving around. There we go. Okay, and just a little bit of a different direction. Just a different direction there. Are you okay? Great. Okay, I'm just going to remove the otoscope now. Very gently remove. There we go. You did great there. Are you alright? Not dizzy? Okay, I'll just do the same on your right ear. Okay, keep nice and still again for me, thank you. Gently inserting the otoscope. There we go. So have a look around what I can see of the ear canal. It looks okay. Just moving around a little there. Okay, just a little bit of a different direction. That's perfect. That's wonderful. All looking good. Okay, just going to gently withdraw it now. Perfect. Okay. Everything is looking absolutely wonderful for you to go home. Well, your vitals are really good. So what I'm going to do, I'm going to remove the cannula. The doctor will be along shortly and he'll sign everything off and go through a few other things with you, and we'll get your medications to take home, and we'll inform your contact to come and collect you and give them all the details that they'll need to know too. Okay, so let's give you another little sip of a drink there. Alright. There. Wonderful. Right, Now, removing the cannula. I'm sorry, it's really, really sticky what we use, okay? The dressings that go on top of the cannula to hold it in place are super sticky because they have to keep it very secure. So it could be a little bit irritating when I pull it off. I'll be very, very gentle. Just take some nice breaths, okay? Keep breathing. I'll go as slow as I possibly can. Alright, but I'm sorry in advance if it feels a little bit sore as I do it. Okay, alright. You're doing really well. You'll soon be home. Okay. Alright then, so let's have a look at this hand. Right. There may be a little bit of bruising where the cannula's been in, but don't worry about that. It'll soon go away. It also might feel a little bit sore for a couple of days. Okay. Alright, I'm slowly starting to peel the tape off now. Okay. Sorry. Okay. I know, it's quite a lot of sticky. There we go. Nearly done now. There we go. Now keep very still while I remove the cannula. Okay, it might feel a little scratch as I do it, but it'll be over very quickly. Okay, nice and still for me, thank you. Okay, and there we go. Perfect. Let me just hold that on there a second. There. Well done. That's the worst bit over with now. Okay. Right. I'm going to pop a dressing on, alright, where the cannula was. And we can give you a couple of dressings as well to take home with you. Okay? It's a nice soft dressing, but these aren't that waterproof, okay? So try and keep the area dry for a little while. Just going to pop them on. Just gently open. There we go. So let's get this onto the back of your hand. And one side. And there's the other. Okay, just gently press around the edge. I'm sorry if that's a little bit sore too. Okay, so I can see the doctor's just coming round to the ward now, so he'll be round to see you and to take a look at my notes to make sure I've done my job properly, and then I'm pretty sure we'll get you on your merry way. We'll get you something to eat and a hot drink. Okay, alright, so you just rest there and we'll just wait for the doctor.